Everyone, welcome to the Livelong podcast, where your health is your power. My name is Erin Hunter, and I am the senior editor here at Livelong Media. Today, I am joined by Dr. Aleece Fosnight, the medical advisor at Aeroflow Urology, the CEO and owner of the Fosnight Urology Center, and she is a board-certified PA specialist in urology and women's health. So, this week on the podcast, we are talking about the bladder. We're headed to the bathroom, and for good reason. So, as Dr. Fosnight will talk about, bladder symptoms and bladder problems might not just be about your bladder. So, research suggests that symptoms like urinary incontinence and other underlying issues could actually signify dis-ease and other issues in the cardiovascular system with your heart. And so, we're really going to tap into the predictive power to improve health all around. And a real quick aside, our upcoming Livelong Health Women's Summit is coming on April 17th and 18th. It'll be at the Masonic in San Francisco. It's going to be a beautiful venue, 75 experts talking about everything in women's wellness, from hormone therapy and cardiovascular issues to preventing dementia and trying to slow down all these diseases so you can live better for longer. So use the code Erin at checkout when you go get your ticket. So without further ado, though, Dr. Fosnight, thank you for coming on the show.
Thank you so much for having me. It's a pleasure to be here.
It's exciting because bladder issues, I feel like a lot of people just see them as you use the restroom and you move on. There's a lot more to this story than just using the facilities because your body needs to, right? So,
Exactly. Mhm.
to start, can we just talk about, from a longevity perspective, why is the bladder important? And what are symptoms that arise when there's a little bit of dysfunction going on down there?
So, from a longevity standpoint, the reason that we want to bring attention to the bladder is we know that the longer that we are living, that our body starts to make changes where it is not functioning as best as it could. Wear and tear can happen to that bladder. And the bladder is a muscle and it has layers inside that help to protect that bladder from the waste products that are in your urine. So the longer that we are living, the more potential that bladder can start to break down and not work as well. And there is this constellation of nerves and vascularity that and connective tissue that are also being impacted by different disease processes that can impact that bladder then later on down the road. I think you asked about, urinary incontinence and how people, I think, take for granted their bladder and how it is actually working. And especially for female identified individuals, they think that any kind of leakage, when you're coughing or sneezing, which is stress incontinence, or this urgency and I got to rush to the bathroom to go and you're leaking on the way there or you don't make it, that is normal. And I like to differentiate the difference between common and normal. It actually should not be normal for you to be leaking urine. I know it's a big shocker. It's super common though, right? We know that a lot of women, we talk a lot about it. Oh, don't make me laugh too hard or you'll make me pee my pants, right? Or, oh my gosh, I hear running water. We talked about, right, hiking here in the mountains of Western North Carolina. We have lots of waterfalls, but when people hear water falling, they have to rush to go to the bathroom for that. And that can be really impactful in your life and your quality of life. So, what are those things that we can do to help acknowledge? I think the first one is going, okay, are you experiencing this? And if you are, there are things that we can do. And if you're not, what are the things that we can do to help prevent that
Mhm.
from happening as well?
So, to go back to the waterfall example,
Yeah,
is there a psychological element to bladder issues?
there is. And we see this a lot even in anxiety. And it has a lot to do with those nerve sensations and the signaling to the brain. It is the mind over matter pieces of it. So when your body hears it, it sends a trigger in your brain, especially if behaviorally you are making this habit where you're washing your hands and you feel like you go to the bathroom, so you go. And if you do that every single time, or you're here water, or it's raining outside, your body remembers that. And there's a protective piece of it, right? We don't want to pee our pants. That's not what we want to do or what is socially acceptable. And so it is this panic that sets in. That panic comes with that sympathetic nervous system, which is also where anxiety sits. And those pelvic floor muscles, which are supporting that bladder, start to panic too, and they tighten and they shorten. And that displaces the bladder and creates more pressure in the bladder. So you get the sensation of that you've got to go to the bathroom right now. So, yes, that was a long answer to your question of yes, there is a psychological component to this need and urgency that happens with your bladder.
Well, it really strikes me that the mind everything connection, right? The mind gut, the mind brain, the mind
Mhm.
pelvis, mind bladder here. And it just makes me wonder too, like, wow, how if as we get older, and not even as we get older, let's say we have anxiety and that sympathetic system's revving and it's telling you got to go to the bathroom and this and that and the other. Is that a benign issue, or can that cause deeper issues down the line if you continue to experience that pelvic floor tension and weakness, etc.?
So it can escalate to a more concerning issue where maybe your bladder now has been trained to not hold and have as higher of a capacity as it once did. So now you're training your bladder to have to go with smaller and smaller volumes. And then it makes it more difficult for you to empty. And let's say now you try to push when you go to the bathroom because you feel this urgency and you're like, I know I have to go to the bathroom, but your bladder is actually not full enough to create that mechanism for your bladder to squeeze and for those pelvic floor muscles to relax, to allow that urine to come out. So you create this dysfunction and this disconnect between how your bladder really is supposed to be physiologically functioning and then the mind, the psychological part of it, of you trying to go to the bathroom. So this perpetuates fear, not wanting to go out. So you're having some social isolation. A lot of pelvic pain can then happen, pelvic floor muscles, especially for an individual, right, who has a vulva and maybe they're having some sexual activity that can actually cause pain with sexual activity. So it very much has this kind of cyclic snowballing effect that can happen if we don't talk about it sooner than later.
So, as we're talking about it, and before we even dive into the link with the heart, which is the very a very much larger issue, right?
Mhm.
What what is there to do to support people who are experiencing this? And as you get older, if it gets weaker, what can we do to create more comfort in the body?
Absolutely. So, one of the first things that I recommend to, I would say, most of my patients, if not all of them, is pelvic floor therapy. I think pelvic floor therapy is an underutilized service here in the United States. In some of our other countries, especially over in Europe, Australia, and New Zealand, it is utilized across the board and is first line therapy for everybody. For instance, if you have a baby, you get pelvic floor therapy, whether you had a cesarean or a vaginal delivery, no matter what. We understand the importance of prevention, right? And so we know that there are certain things that can cause this. Constipation can weaken the pelvic floor and the bladder. Yes, holding or different careers. So I love my teachers and I love my nurses, but they do not have enough time to access the restroom like they need to. They don't get to hydrate enough and drink enough water. Right. And some of my teachers are waiting 6 and 7 hours to go to the bathroom because they can't leave their classroom.
Mhm.
So we are also perpetuating, right, these habits on how our bladders and our pelvic floor are working. So our amazing pelvic floor therapists can really help to isolate, to get that connection back in your body of understanding your pelvic floor muscles. And there is also a misconception between weak and strong muscles. A lot of people will say, oh, I want tight pelvic floor muscles. You don't want tight, right? Tight means shortened. I think about our shoulders and our back, right? If things get tight and tense, that muscle gets shorter and it's actually a weaker muscle. So we want to be able to have long, lengthened muscles that have the ability to contract. We want it to have enough strength in there and enough of a bulk in those muscles so that you can contract and you're able to then, from a pelvic floor standpoint, support that bladder. And then also for that bladder muscle to do what it needs to do to be able to relax and to fill and then to squeeze and to empty.
It sounds a bit like the principles of yoga, which is like strength through flexibility and
Yes.
ease.
Yes. Yes.
That's fantastic. Is real quick, just one last thing. Why, as we get older, does this idea of hearing water, need to pee, laughing, need to pee, why as we age in particular? Is it just that tightened pelvis at the root of it, or is it hormonal too? Is there a certain aspect of other physiological changes?
I don't necessarily think that it's age. And for so often, we have blamed age on lots of things that start to break down in our body. Well, yes, I do think that the exposure and the oxidative stress that we go through can contribute to it. But I think that we have used it as an excuse to say, oh, it's just age, right? It's just age. There's nothing you can do about it. And I don't take that as an answer. I think there's a lot that we can do to help support our bodies to slow the aging process, to slow that oxidative stress and the wear and tear on our bodies. Hormones, for sure, right? That is something, especially again, for those that are going through perimenopause and menopause, that we are outliving our ovaries by half our lives. So the lower urinary tract, so they're in the bladder and in the urethra, as well as the pelvic floor muscles, have estrogen and testosterone receptors. So as your body is becoming deficient of both of those start to thin out and you lose the strength in the muscle. So like even testosterone is so important for women. Women have 5 times more testosterone in their body than they do estrogen. And that is an important, I know, that's an important factor when it comes to pelvic floor muscle strength and adaptivity. So we have to think about those things too. And this is happening at a much more progressive rate than it is for our male patients. They're also losing testosterone, but they're losing testosterone slowly over the course of 15 to 20 years, where women are losing that same amount, but over the course of 3 to 5. So it's much bigger of a deal. And then we have to think about pregnancy. Just being pregnant can add some stretch to that pelvic floor. And again, we aren't doing a good job here in the United States of supporting our women postpartum to be able to do pelvic floor therapy, to get that strength back in our pelvis, right? That pelvic floor muscle expands by 290% if you're having a vaginal delivery. So you've got to be able to help get it back into that physiological state afterwards. But if we're not putting in the work, if we're not having insurance cover pelvic floor therapy, right? Or we don't have the time off to go do this, then we are putting our patients at a disservice the longer that they go without that support. So I'm going to push back and say, I don't think it's aging. I think it's society. I think we sit too much. I don't think we move our bodies enough. I don't think that we drink enough water. I think that there is a lot of waste products that occur and that irritates the bladder. And then, I mean, this will be kind of a good transition into the cardiovascular side of things. Then, when we think about how these conditions with diabetes, high cholesterol, neurogenic concerns, that all impacts the bladder, right? When we think about that shared physiologic pathway, it's nerves and vasculature. That's all going to that bladder too. And it isn't just the heart or the large blood vessels that are being impacted, right? We have blood vessels, microvascular, right, all the way to our fingertips. And that can be impacted in our whole bodies. And so I love that we are having this conversation and that there's more research coming out as the bladder as being kind of this clue or this first potential symptom that we need to start screening for additional things.
S- So that's incredible. That's all a very good perspective to share with everyone. And the word you said there, which I want to latch onto and get into, is using the bladder to screen for other issues. So let's dive into that because you had mentioned the cardiovascular system, the vascular, the brain, everything's connected. Now, why though the bladder over other organs would we use as that first biomarker to be like, huh? If something's wrong down here, is there something wrong with my heart? How does that work?
That is a symptom that somebody can verbalize right away, right? This isn't, you don't have to go to get a lab test. You don't have to go into the office to have a certain symptom measured. You can track your urinary habits on a piece of paper with a pen. So it's something that is occurring pretty often that you can control and track much easier, like I said, than going in, right? In order for you to know if you have diabetes, you have to have a blood test, right? Or you have to have a glucometer that you're, doing finger checks, finger pricks to see what's going on. Whereas urination should be happening every 2 to 3 hours on average. You kind of know what your typical symptoms and frequency looks like, color of your urine, smell of your urine. You typically know that. So if something changes, you're going to be the first one to see and then to be able to communicate that to your provider.
Now, why though would my first thought, if I do a pee stick and I start to notice things, and as you said, you could do the paper, why would I assume to look at the heart first?
You probably wouldn't, actually. As a person who is not in maybe a medical training or a medical situation, you probably aren't. Because in the world, in society, we haven't made this connection very easy or loud out there, right? We think about, babies, postpartum, women in particular, but this can happen with our male patients also when they start to notice some changes in their urinary function. But the connection really hasn't been illuminated out in the real world.
So, what changes would someone look for? Not just like changes in color, but is it a certain color? Is it a certain smell? Like, I know after you eat asparagus, your pee kind of smells. That's normal. So, is that the smell you're looking for on a daily basis? I think it's just there's probably so many clues that people would be curious to know, wow, what am I supposed to be seeing?
Exactly. So color is one of the first things, and that is definitely from a hydration standpoint. So if you notice, and we have to remember too, that you are urinating into a toilet that already has water. So it is going to dilute the color of it. So even if it is looking a little bit more kind of yellow, if it has any more of a brown kind of tinge to it, that or a darker yellow color, that means you are pretty dehydrated, and drinking a little bit more fluid would be helpful for that. If you notice that there are particles in your urine, that can be another thing, that there is something with a change of the filtration, maybe with your kidneys or how your body is processing those waste products. The other thing to think about, you said, is odor. So when there is more concentration of that urine, so that kind of a more of ammonia smell versus how your body is breaking down different metabolites from foods, that can be another potential indicator that something's going on. But really, from a cardiovascular standpoint, you're looking for new onset or worsening of your urinary incontinence.
Mhm.
So if you are noticing worsening of your urgency, and it's been a pretty drastic change, not a subtle change over time, so more of a drastic change. If you notice that all of a sudden you're having to go to the bathroom more frequently, so maybe you were going to the bathroom every 2 hours, and then all of a sudden every hour you're starting to notice that you have to go a little bit more frequently. Those are going to be kind of those bigger signs and symptoms that you are going to start noticing.
And is this after getting potentially UTI test?
You could, yeah, you could go and get and think maybe this is a urinary tract infection.
Hmm.
And I will say that 50% of the time, and this is my clinical experience, I'm not really sure what the actual research shows, but for me in my clinic, 50% of the time, that those individuals that are presenting with urinary tract infection symptoms don't actually have a urinary tract infection. So that's the first.
50%?
Oh, yes,
What?
especially yes. So especially for my female identified patients when they're getting into their 40s or late 40s, because we're thinking about all of those hormonal changes. So it's something called genitourinary syndrome of menopause. And that is because everything starts to thin out. So you're getting burning with urination, urgency and frequency. So it's important to rule out a urinary tract infection first. That's what I always tell people. I need to go down. Are you having symptoms because it really is a UTI, or is it not? And if it's not, we're not just going to say, oh, well, try to drink more water and move on. What is the root? Why is that happening with this individual? And we're going to start to ask those questions of, what does your family history look like for cardiovascular disease? What does it look like for diabetes? When was the last time you had your blood pressure checked? When was the last time you were checked for diabetes? So we're going to be looking for all of those other contributory things that could potentially causing those urinary symptoms.
Is so when you notice this and when you go down the list, the boom, boom, okay, it's not this, okay, but we have this and this and this. What is usually the effect of when after women and men come to you and all of a sudden you're like, oh boy, this could symbolize something worse? Is it going to the cardiologist and then hopefully saving someone's life or at least like it's mitigating it getting any worse, right?
Yeah, absolutely. So referrals, especially from the urology side of things, we're seeing a lot more referrals, and even from the American Urology Association of saying, all right, if these things are being presented at the urology office, sending a referral to the cardiologist is going to be one of the first things that you need to do if somebody has not had a cardiology workup, especially again in our female patients, right? The number one killer of women is heart disease, and they don't present the same as our male individuals do. They don't get the same types of plaque buildup. They have more soft plaques that build up in their coronary arteries that don't show up always on a stress test. So we have to make sure that we are advocating for our patients too and helping to get them connected with a specialist, especially like a cardiologist.
You know, what this all makes me think too, and I'd love your professional opinion on it. If you start to work on bladder health more and pelvic health more, can that actually influence cardiovascular disease risk?
It can, yeah, because the things that you're doing to support that bladder are also supporting your cardiovascular function. So things like moving your body, drinking more water, eating more whole foods, right? Things that aren't going to irritate the bladder. Fiber increase. So again, and my folks at Aeroflow Urology, and if anybody has heard me talk before, they know how much I love to talk about constipation and that's impact on the bladder. So if you are eating more fiber-rich foods, more whole foods, avoiding any of these ultra processed foods, you're going to have really good bowel movements and not get constipated. When you get constipated, that puts extra pressure on that pelvic floor and your bladder. So you're going to have to go to the bathroom more frequently. You're straining too, which could also cause damage to the nerves of your bladder and your pelvic floor. So they go one and the same of being able to take care of constipation. So, and we know, right, if you have more fiber, that can actually help to lower any of your cholesterol, your triglycerides. Ultra processed foods are going to contribute to diabetes, and your body isn't going to process it as much. So, yes, by focusing on your bladder health, I do feel that you can then also improve your cardiovascular function.
That's epic. And
Yeah.
it's such a bing to the bing to the bing to the da 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 da, all the way back to constipation, which isn't bladder, it's GI. Like, and it's just really an interesting circle of connections in
And do you
order
want to
to
know
eventually get.
what
Hmm?
else is fun when it comes
Yes,
to your gut? You talked
yes,
about like the gut and the brain,
yes.
but the gut is really important for your body to absorb hormones. So if you don't have good gut function, your hormones can be affected too. So again, I love the body and how it is all connected from a physiological process.
So, all that said, and as we bring the conversation to a close, Can you what's a bladder myth people often believe that it's like, oh, drinking cranberry juice like for a healthy bladder or what have you? What is a myth you just want to tell the world? Stop to actually have good health and whatnot. Don't listen to that.
Gotcha. So what we talked about earlier is that your bladder symptoms are normal, right? And that there isn't anything to do about it. That is a huge myth. We have lots of options to help people to support their bladder symptoms. I can't guarantee that we're going to get it back to perfect like it was before, but we're going to do our best to help to alleviate those symptoms so that you have more good days than bad. And so that is a huge myth that I have a lot of people that said, I've been dealing with this for 5, 10, 15 years, and I thought it was just something that I had to live with. But it wasn't until a friend or they saw an article or they listened to a podcast where they were like, oh, I don't have to deal with this forever. There are some things that we can do that they've felt empowered to then make that appointment. We know that the healthcare system is overwhelmed and that we don't have enough people to take care of everybody. So, from a primary care standpoint, being able to screen for urinary concerns is low on their totem pole. They are screening, it's a little backwards, right? So, they're screening for the cardiovascular stuff and the diabetes. And we also need to, again, support our patients with asking that conversation of, are you having any urinary concerns? Some of my patients, have urinary incontinence and leakage, and there's something that you can do about it. Is this a concern for you? So, illuminating and highlighting that you don't have to deal or suffer with this is really the biggest thing.
I think that's huge because going back to what you mentioned with the psychology of it, I mean, no one wants to be leaking when they're
Mhm.
moving or feeling nervous about hearing something. And Lord knows now you're in discomfort and you're worrying, oh my gosh, if there's no restroom nearby, what do I do? And it just pulls you away from the present, really. There's a mindfulness aspect here too that could be very stressful.
Yes. And there has been some good research out there that shows that when people feel secure in their bladder function, that they enjoy activities, they feel present, they have better quality of life. And this is a really important thing that we need to have more discussions around.
I appreciate this discussion. This was fabulous. And it's just eye-opening because it's exactly what you mentioned. And no one's thinking to screen for urinary first. You're going to go to the worst case scenario first. What if we didn't go to the worst case scenario so we could prevent the worst case scenario by looking at the earlier alarm bells?
Yeah, exactly.
So, last question. Just this isn't real, it could be related to bladder if you'd like, but what's one thing that you like to do for your healthy aging and longevity and something you do on a daily basis?
Mm. I definitely do some mindfulness. One of the best things that I have done for my health, I have about a 35-minute drive in the morning to go to work. I don't listen to anything. I let my mind, I know, right?
Oh my God, I
Ah,
can't relate.
but it was so amazing. I started doing that probably about a little over a year ago. I have so many things on my plate. I'm trying to learn as much as I can. We have exponential. There's so many podcasts or books to listen to or to read, and so our brains can get gummy, and that can really stop us from having good critical thinking, to allow our brains to process and to get more creative. And so, if we are constantly having this intake, we can't have outtake. We can't do outputting of that information. So, one of the things that I did was I stopped listening to anything. And it took me, I was very uncomfortable for probably a good 6 or 7 weeks. But eventually, I can't listen to anything anymore now while I am on my way to work. It's this area for my brain to just expand, for me to sit in the present. I had always felt too that I was rushing. All right, I can't wait for Friday. I can't wait for this, or I can't wait to get to work, or can't. But we miss all of the little details in between. And so slowing down, enjoying the present, and not listening to anything and allowing your brain to get creative and to allow it that space to think has made a huge difference.
It makes sense. It really makes sense. And I think that is valuable advice for anyone, myself included. I try, um, I think the motivation's there, but the continuity isn't. So it's about making it a habit rather than deciding to do it and then falling off the bandwagon. Like it's the consistency that's the hardest part.
That's what I was just going to say, consistency for everybody. So consistency with drinking enough water, moving your body, thinking about your nutrition, not listening to anything on your way to work and resisting that, like for me to reach over and turn the knob to turn on the volume for the radio. It takes a lot, but it is well worth it in the end.
You're turning down the volume there to turn up the volume in your brain.
Yep, exactly.
Epic. Well, thank you so much for coming on and sharing everything from the mindfulness to the screening to just an entirely different way of thinking about the thing you need to do every 2 to 3 hours, right? It's
hmm
not just rote anymore. It's something that impacts health and should be just considered for a good life and a healthy
Yeah.
life.
Yeah, absolutely. And recognizing too that, you can work on getting your urinary incontinence as best as you can. There are going to be some situations where you still might have that. So being able to feel confident with using protective underwear, a protective pad, and Aeroflow Urology has lots of those resources to support folks who are still needing some of those support, again, so that you can still enjoy those social activities and watching, a movie without having to feel like you have to get up, so don't forget about those resources as well.
Beautiful. Thank you so much for taking the time to come on. We really appreciate it.
Yeah. Again, it's my pleasure and thank you so much for having me.
Thank you.